Our own little mantra inside our office is we want to inform before we perform. The things that are tried and true, number one, is taking care of the patient. Number two, listening to the patient. I recommend to patients at LUF Dental to come and visit us every 6 months. That helps us to establish a baseline level of what your care needs to be, take care of you, get your teeth cleaned, and spot any problems that may be there that we can fix before they become bigger. And so it's not uncommon that I have a patient that will say, oh gosh, I say, when's the last time you were in our office or in a dentist's office? And they go, yeah. So I usually know that means that it's been quite a while. And so it's so much easier when I see my patients every 6 months. So if I'm going to help you get on track with your dental care, I am going to want to see you every 6 months. Primarily get your teeth cleaned and examined. We take x-rays once a year during that examination. Now, there are times that we want to see you more often. There's times when we're going to want to take more x-rays, but that's all done with the thought that this is what we need to do to help you get fixed. Well, bad breath always comes to us first, but sometimes bad breath is not a dental problem. And so initially, if you come complaining of bad breath, we're going to check for decay in your mouth, because if you have a lot of decay in your mouth, it could be trapping food. It could just have an odor by itself, and that may be one source. Get your cavities fixed. The biggest thing that we see is gum disease. Periodontal disease is the big fancy name. That is where bad breath comes a lot. And so again, we would need to get you on a program to help your periodontal disease. We can't cure it, unfortunately. Periodontal disease is kind of like heart disease or diabetes or any of these systemic problems. In fact, we're finding out now that periodontal disease has a systemic connection between the heart and diabetes and some of these other systemic things that are going on. It's not necessarily a direct connection, but we know that studies have shown that someone with periodontal disease may also have some heart problems. Periodontal disease may also have some diabetic problems and some issues. And so we do what we can within the mouth to help take care of that so that the bad breath goes away. Yet, like I said at the beginning, sometimes bad breath can come from your stomach, can come from your lungs, other parts. So if we exhaust trying to fix it on our end and we get nowhere, then we'll probably refer you to your general physician to see if there's something that they can help you with. Where the enamel ends on the tooth and the root surface begins, there are thousands and millions of little pores that go directly into the nerve. Normally, those are either covered by bone or tissue, but they're also plugged up with things that we eat on a regular diet. Sensitive teeth is probably one of the most misdiagnosed things, because a lot of the things that we fix and take care of come from sensitive teeth. Decay can make your teeth sensitive to cold. Infection can make your teeth uncomfortable. Lack of cleaning with a lot of tartar and calculus can make your teeth sensitive. Gum disease can make your teeth sensitive. You know, I'm very pro bleaching, but one of the things we have to keep in mind is sometimes bleaching can make you teeth sensitive for a couple weeks while you're doing it. Crowns and fillings can make your teeth sensitive for a couple weeks because we've dried out that area. The main thing is we need to get those pores plugged up again. There are toothpastes that have potassium nitrate in it, and that's a big buzzword. I'm sorry to throw that at you, but that is what plugs up those microscopic pores. And it takes a couple weeks once you get on that, but usually those toothpastes have everything else your regular toothpaste has in it, in addition to this special salt that helps plug up those tubules. Bleeding gums is very common, but in most cases, it's because you haven't had your teeth cleaned for a long time. Plaque, which collects down at the gum line, is composed of a lot of bacteria, and that bacteria can initiate a response from the body to send more blood cells to take care of that. And so the gums get very, what we'd say, capillary rich, meaning that there's a lot of blood cells that come. Sometimes the gums really turn red if it's really bad. And as long as that bacteria is there, it's not going to get better. And so if you are brushing your teeth and your gums start bleeding, usually it's not that you've done something, it's usually that you haven't done something, which means you haven't had your teeth cleaned. One of the terms we use for bleeding gums or inflamed gums is gingivitis. There's also pregnancy gingivitis. Women that are in a certain portion of their pregnancy may just have to fight gingivitis because of all the changes that are taking place in their body. That can be taken care of and corrected, but it is a source of alarm for some people if they get that. And so we want to make sure that you have all the tools that you can do that. There are other reasons that gums bleed. You could have a place that packs food, and once you get the food kind of does the same thing that the bacteria does, the area gets inflamed and starts to bleed. Once you clean that out or fix the tooth problem, it goes away. And then sometimes infections can make things look like they're bleeding a little bit. But the main thing is need to get your teeth cleaned. The main thing we got to worry about is sugar. You know, I found out about 10 years ago that I'm a diabetic, and I have to be careful with sugar. I've got a big sugar tooth, so I've got to really be careful about that. And too much sugar can create a lot of decay in your mouth. And the process is that there is a certain bacteria that all of us have in our mouths, and that bacteria also likes sugar. And as it metabolizes and breaks down that sugar, it turns it into acid, and that acid erodes the decay and begins the decay process. Once it gets through the enamel phase, it can move a lot faster to the inner layer called dentin. So we always want to find out what patients are putting in their mouths. Starchy foods turn to sugar, and then that process starts. Energy drinks are laced with sugar, full of sugar, and then they're also very acidic. So if you are worried about the sugar becoming a problem, then you put acid in there with it. It's already multiplying that problem a little bit. You could go to any kind of diet drinks that don't have sugar in it and use them, but we still have that problems with acid. I wish I had the picture of the chart I had years ago that showed the acid content, or the pH, and sugar content in sodas and energy drinks. It's unbelievable how much is in there that we don't know about. So if you have to have a Coke, if you have to have an energy drink, or you do have to have something with sugar in it, then make sure that you're rinsing your mouth out to neutralize what that sugar is going to do. You may not be in a place where you can brush. Yes, brushing would be best. But if you can't, take some water, swish, spit it out to get rid of all that stuff that's causing decay. Just make sure you use wise choices. But I think from a dental perspective, sugar is the killer. You'd be surprised, sometimes a good cleaning can whiten and brighten your teeth. Now, if they are not um, happy with the results of what their natural tooth color is, then we do recommend bleach. One of the interesting things about bleach, because you hear about all these techniques and all this stuff going on, it's all essentially the same material, maybe a different concentration, but it's all about how it's placed on the teeth to bleach. And, if you go to the grocery store, you get the strips. They work pretty good, but they're pretty cumbersome to use. If you come into the office, we make some custom trays that you put bleach in. It holds the bleach better on your teeth. Maybe you get a little bit better job of color change, but it probably has more to do with the fact that you're able to wear the bleach longer than the cumbersome strips. And then also you can get, whether it's done with a light or a substance that's painted on the teeth, I always call it type A bleaching. If you got a type A personality and you want to get it done right away, we can do that. And one of the most common ways is a porcelain veneer. A porcelain veneer, I always think of them as fake fingernails for teeth. We do have to reduce your teeth some, but the veneers are bonded onto your tooth structure, and they can totally change your smile, make your teeth look straighter. Not everybody's a candidate for them, but most people are. And crowns. Crowns will help get rid of the stain as well. I would put a caution mark out there, is there are new ways to get veneers by what's called a veneerist. Well, in the state of Texas, they are not dentists. They are not legally allowed to do that. So be very careful about going to a veneerist. Go to your dentist who knows what's going on. He's going to take care of you. I'm going to take care of you. What I want to do for my patients, for you, is to treat you better than you've ever been before. Not only from the standpoint of dental care, but learning about you, getting to know you. I really try when I meet you the first time to try to find that common bond. Everyone has a common bond that we could maybe share. And that just makes it so much easier for you, for me, my team, to give you the care so that you'll leave comfortable, happy, and share with others about how we've taken care of you.